Hospital and KMPDU are at odds over claims of poor governance and working conditions at the facility. As tensions rise, the hospital has dismissed allegations by KMPDU, labeling them as baseless. The hospital's board has also denied the 17-day strike notice issued by KMPDU on Tuesday, stating that they are only consultants at the facility. And Odida reports that the standoff has escalated, drawing attention from healthcare workers and stakeholders alike.
Tell everybody out there who has nothing to do at the Nairobi Hospital not come here.
This standoff between the Nairobi Hospital and the Kenya Medical Practitioners Pharmacist and Dentist Union KMPDU escalated on Wednesday after the hospital issued a fiery response to allegations of poor working conditions and governance challenges.
We have not had, as an institution, any formal complaint from our local doctors that they are being mistreated, they are being underpaid.
The controversy began when KMPDU, the Kenya Hospital Association and the Admitting Staff Association accused the hospital's management of financial mismanagement, poor treatment of healthcare workers and failing to adhere to court directives. In their initial press conference, the union declared a strike notice, giving the hospital a week to address the concerns or face a total shutdown of operations.
And if they don't go in the 7 days, we are saying the strike that will begin here will be a warm-up towards the national strike.
However, Nairobi Hospital's response was anything but conciliatory. The hospital board's chair, Dr. Chris Bishage, hit back at the union and its allies, claiming that those raising complaints were not employees of the hospital.
People were talking yesterday, and I'm sure some of you were in the interview, and they're giving wrong information that we are not paying good salaries, we don't have good terms. They are not our employees.
When you have individuals who are hired guns out there making statements on matters private institutions, while they should limit themselves to the arena of public institution.
Calls for the resignation of the board by KHA were also dismissed, with the board pointing out that recent elections had been conducted just last week, which also gave members of KHA the opportunity to vie for leadership positions.
And these people who are making noise out here, they had an opportunity to be elected if they are members of Kenya Hospital Association.
The accusations of chaos during the hospital's court-mandated annual general meeting were also firmly denied, with the hospital stating that there was thorough registration and vetting of participants and that the allegations are baseless.
From my records, they registered themselves, they were screened, they were confirmed to be paid-up members, and they participated in the meeting.
Despite the hospital's assurances that operations remain uninterrupted and patients continue to receive world-class care, the unions remain unconvinced. KMPDU had insisted that the allegations were rooted in legitimate grievances from healthcare workers who have been subjected to poor working conditions. As for the December 17 strike notice, Nairobi Hospital has categorically stated that it will not materialize. Ann Odida, TV 47.